adjustment hurt? That's the subject of this video. Hi, I'm Dr. Shakib from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic. Stay tuned. All right, so one of the things that I'm asked, not so much by my patients, but outside my office, is if the adjustment actually hurts. Adjustment should not hurt if your chiropractor does the preliminary work. And one of the requirements for the adjustment, assuming there are no contraindications, in other words, there are no underlying conditions that would take the adjustments or make the adjustments not be suitable. Those are rare, but they do exist, and us as chiropractors do our examination and checking to make sure you're not one of those people. One of the things that you need to understand is that if an adjustment is performed correctly, if the body is relaxed and there is no resistance against the movement of the spinal segment, then there should never be a painful adjustment that would take place there. So let me explain here for a little bit. For one, not every adjustment requires the cracking of the neck and back or whatever body part it is. We're working within what is referred to as physiological zone. So if you look at my finger, it's at rest. At this juncture, I can lift my finger up to here, and that's the end. With the assistance of someone else or something else, I can go from this level to that level. That's the physiological zone. Beyond that, I can, and that's even further. And beyond that, I can actually hurt. So when we're working within the physiological zone, because it's outside the normal range of motion that you're able to do by yourself, there are certain hormones that get released and it actually relaxes the person. So within the physiological zones that happens, and it's really a natural thing because nature is thinking, wait a minute, maybe the lion is chasing this person and this person is hurt because that's outside your normal range of motion. And so this person cannot afford being in pain because needs to get the heck out of the area. So it actually tranquilizes you so you can get out. It's purely for the survival of human species in this case. So adjustments take place within the physiological zone. So do mobilization. When we're adjusting as chiropractors, and that's one of the reasons why I'm not a big fan of crack out the door, next one type of person, is we need to tune in to really feel the segment, to really feel the surrounding area. The environment needs to be nice and relaxed. So when we're about to adjust, assuming it's diversified, the type of adjustment that there is an actual audible, is the actual cracking noise that you hear. And there's more than just that kind of adjustment, by the way. When that happens, if the person is not able to relax, we're not talking about conscious mind, because many times patients tell me, oh, okay, I'm relaxed. It's like, no, actually, you're not relaxed yet. So when that is in place, when the person is relaxed and the chiropractor is actually not in a hurry to get the patient out the door, then that adjustment will never, ever be painful because it's a pure in-sync movement of the adjustment. The patient, there is a breathing that has to take place in sync with the movement. There are a lot of preliminary requirements that have to be there. So adjustments should not hurt if all the requirements are met. And also understand there is more than one type of adjustment. So while there may be a pre-existing condition that makes one type of adjustment not a suitable one, there are other types of adjustments that can do their job. It's kind of like there is more than one way to get home. So if that one main road is being worked on, there are detours that you can take. There is more than one way to get home as long as you get home. I hope this helped you. If you have any questions, please make sure you contact the office. All the information is in the description box below. And make sure you subscribe to my channel. Until next time, take care.